Welcome to the Rural LGBTQIA Health Seminar. This presentation will give an overview of the terminology and concepts related to LGBT populations and briefly touch on areas which may require special attention from a healthcare standpoint. Gender is not equivalent to sexuality, neither of which dictate our behavior. For instance, over 70% of men who report having had sexual activity with other men identify as heterosexual. Sex refers to an individual's biological status as female, male, or intersex. Gender, however, is a cultural concept which refers to our expectations for how people should act in correlation to their biological sex. The concept of gender needs to be broken down further in order to truly explain the nature of human beings in regards to gender, sexuality, and behavior. Gender identity refers to one's internal psychological, mental, and emotional sense of being either female or male. Often, an individual's gender identity is counter to what our cultural expectations are regarding our perceptions of that person's biological sex. For instance, a person of female biological gender may identify psychologically with a male gender identity. When someone's biological sex and gender identity do not align, they may identify as transgender or transsexual or even another of many identifying categories. Gender expression is the way in which an individual expresses themselves externally, such as through clothing, behaviors or mannerisms, and choice of pronoun. This communication of one's gender within their cultural setting may or may not be congruent with social norms. Gender normative behavior is behavior that is compatible with the cultural assumptions and expectations about gender roles. We will discuss the concept of gender normativity and its consequences in Module 2. Sexual orientation is a term referring to sexual and romantic attraction and behavior. Sexual orientation exists upon a continuum, the common and recognizable categories being homosexual, bisexual, and heterosexual. It is important to note that sexual orientation is a fluid concept, which often changes over the course of one's life given cultural, environment, or developmental stage. This is especially important for you as a healthcare provider to understand and recognize. One's sexual orientation, their behavior, identity, and desire are independent from both their gender identity and gender expression. It is also important to note that someone's sexual orientation is not dictated by their partner at any given point in time. Gay can refer to either men or women who are sexually and/or romantically attracted to and/or sexually active or intimate with individuals of the same gender, or who have the desire to be. Lesbian is the term specifically for women who have or desire to have an intimate relationship with other women. Bisexual, sometimes abbreviated to bi, is a term which refers to individuals who are sexually active with and/or sexually attracted to two genders or two sexes, but not necessarily equally. Note that two and not both is the more current definition of bisexual and includes the understanding that there are more than two genders and sexes, including transgender, transsexual, and intersex. Often people who identify as bisexual are referring to being attracted to both men and women, but just note that this may not always be the case. Transgender is a term which can refer both to individuals who have undergone transitional surgery or those who have not undergone medical transitions but live and identify as a gender other than that assigned at birth. Transsexual is a more dated term. Currently, transgender is often preferred. However, it is always important to ask your patient what they prefer because some individuals do still identify as transsexual. Transmasculine refers to individuals whose gender identity is in the male spectrum of gender, but were assigned the female sex at birth. Transfeminine refers to individuals whose gender identity is in the feminine spectrum of gender but were assigned the male sex at birth. Transmasculine and transfeminine include a wide range of identities, including trans men and transgender males, and trans women and transgender females, respectively. A cross-dresser is an individual who wears clothing of the opposite sex or gender. It is important to point out that many individuals who cross-dress in fact embrace a heterosexual identity. Drag king and drag queen refer to persons who perform in a theatrical manner, expressing either masculinity or femininity. Queer is an increasingly common identifying label, which has been reclaimed from its originally negative connotation to a term used by many young individuals who choose to reject the conventional LGB category labels or who choose to embrace the identity of queer in addition to lesbian, gay, bisexual, and/or transgender. Other terms and phrases that may be useful while interacting with your LGBT patients include agendered, which can describe a person who does not maintain any gender identity, or in other words, is internally ungendered. Intersex, from a medical standpoint, identifies individuals whose reproductive and sexual systems do not fit the standard definitions of either female or male. The acronym LGBTQIA is an attempt to be inclusive and recognize that more than two sexes exist, and to deny this would continue to force everyone into a socially constructed box of either male or female. Additionally, pansexual is a term used by some individuals to express their fluid gender or sex identity or sexual orientation. Someone who identifies as pangendered may be attracted to all or a combination of any other gender or sexual identity. Although the acronym LGBT is commonly used to describe the entirety of a seemingly homogeneous group, in reality, the LGBT community is extremely diverse, not only in gender and sexuality, but also racially, ethnically, and in terms of social and economic standing in their respective larger communities. Identity labels are commonly used in the United States in mainstream culture. However, often racial or ethnic minorities avoid these identifying words because they are part of culture which conventional LGB category terms carry a negative connotation. Same-gender loving is an example of a phrase used by some minority LGBT individuals who are trying to avoid conventional classification. Bi-gendered Native Americans often use the label two-spirited to express their gender and/or sexual identity. Two particularly vulnerable LGBT populations are youth and the elderly. LGBTQ young people are already dealing with the emotional and physical challenges of adolescence, as well as additional challenges such as establishing their own sense of gender identity and sexual orientation, and potentially facing both internal and/or external homophobia, biphobia, or transphobia, which will be discussed more in Module 2. As a healthcare provider, you can offer support which may be lacking from family members or other influential adults. Older LGBT individuals grew up during a time in which there was even less cultural acceptance of non-heteronormative lifestyles than today. These circumstances could have had detrimental psychological effects due to deeply embedded fears of discrimination and social stigma. It is also possible that these fears have caused some individuals to suppress their true gender or sexual identity even into the later years of their life. There are certain health disparities that are seen throughout the subsets of LGBT populations, which as a healthcare provider are important to take note of and recognize for you to best care for your patients. Lesbians and bisexual females are more likely than heterosexual women to be overweight. Lesbians are also less likely to get preventative screenings, which has led to higher rates of breast and cervical cancers. Gay men are at a significantly higher risk for HIV and other sexually transmitted infections. Also, compared to their heterosexual counterparts, LGBT populations have the highest rates of alcohol, tobacco, and drug abuse. Poor mental health and high rates of depression are also prevalent. For more information regarding specific health concerns of LGBT populations, see the link to Healthy People 2020 on our resources page. This concludes Lecture 1. Please complete the corresponding quiz and then continue to Lecture 2.